This makes me so angry. Oh my God. Oh. Look at the way she just looked at her with such indifference. No urgency. This woman has been here for 30 minutes. No pain relief, nothing to make her feel comfortable. Jesus.
Who's your doctor?
Oh my God.
Lang is her doctor.
Why are you asking all these dumbass questions you should already have answers to when you were expecting her for an inducement that very day? This is unacceptable. This is unacceptable. Oh my word.
Y'all treat all your patients like this or just the black?
That part, all the black ones, especially in light of the fact that black women have to 2 to 3 times higher pregnancy-related deaths compared to white women. And we all know why. Because of systemic racism and implicit bias, which is which embodies. I can't.
She had 3 pregnancies, 2 babies at home.
Oh my word. And oh my word.
I bet y'all listen next time.
Oh God, she's in such
When you
pain.
was delivering at this hospital, your ass should have changed doctors.
This evil witch should be fired. She has no business being in healthcare. Let me break this down for you. If you are in healthcare because you see it as a job, get the hell out. We don't want you, we don't need you. If you do not see healthcare as a vocation, as a calling or a purpose, you have no business being there. Because I'd rather a human being with humanity who sees another human being in pain and wants to address that as quickly as possible with urgency than this evil witch who is looking at her like, what is all the fuss about? She does not belong in healthcare. And I think it's been so normalized when people see a woman go into hospital and come out with a baby. People, when that happens, that's by the grace of God, because giving birth is a life and death situation. Let me say it again. It is a life and death situation. I've given birth 3 times, and using my personal experience, let me tell you right now, one of my births, my child was born not breathing. Not breathing. I thank God for the pediatrician that acted swiftly and quickly to bring her to life. Because let me tell you right now, as soon as they put that baby in my arms, and I heard her crying, the name that my husband and I had agreed to give her, as I was about to call her by that name, a different name came out of my mouth, and that's what she's been called to date. Another birth of mine, I remember the doctors and nurses rushing into the room. There were probably about, 5 of them or so, saying, Mrs. Moshe, we have to take you to the theater. I'm like, okay, why? They're like, we can't hear the baby's heartbeat. And I was lying down there waiting to be induced, not realizing there was anything wrong. And of course, it took me in to have a cesarean. And thank God that somebody was paying attention. This is what I mean, that it's a life and death situation. And if these so-called healthcare professionals are not paying attention, anything could be happening to the mother or the baby. This woman, the black woman, was in active distress, active labor, active pain. Anything could be happening to her and to the baby. And this evil witch did not get her the help she needed as quickly as possible, but someone could check what is happening. Check what is happening. People like her should be fired, and they should not be in healthcare. Pregnant mothers, do not go to the hospital on your own. Make sure you go with somebody you know and trust who can ask questions, pay attention, demand attention, and also take evidence of any negligence or misconduct. Because what black mothers are not going to continue to be is the unwilling and unconsenting statistics of how systemic racism kills us.